Hey, great hearing that music on this Wednesday afternoon. It's time for Helping Seniors of Brevard. I'm John Harper. Let's get things underway as I introduce to you the host of the show and the executive director of Helping Seniors of Brevard. Here is Kerry Fink. Good afternoon, Kerry.
Hey, John Harper. It's always such a pleasant Wednesday when we get together around the radio at lunchtime right here on 90.3 FM, WEJF. And welcome if you're listening online at WEJF.net. And if you're catching this later as a podcast, we appreciate your tuning in. And so here we are. We're on Valentine's Day 2024. And we've got an interesting show lined up for you because we have as our very special guest, longtime friend of the Helping Seniors organization. He's actually the guy who got Joe Steckler started in radio, talking about Joe Steckler, our president and founder, years and years ago when he had his very own radio show. But he's also known as one of the area's top periodontists. His name is Dr. Lee Sheldon. Happy Valentine's Day, sir. How are you?
And happy Valentine's Day to you, Kerry. And I just realized the topic that we're about to talk about is so pertinent to Valentine's Day, but it may give people guilt feelings. And maybe we should have scheduled this on a different day, but here we are talking about sugar.
Yeah, well, this is tough love, right?
Yes, it is.
on the day that you normally give your loved one the bonbons and all that good stuff, we're going to talk about this. But actually, before we get into the today's topic, which is how can you help your diabetes, I want to share a couple of dates, particularly because it is Valentine's Day, and these are a couple of fun things that are coming up. And so I want to give you a moment to grab a pencil and jot this down because a week from tomorrow, so this is Thursday, February the 22nd, we're talking about Thursday, February 22nd, at Joe's Senior Resource Center of Brevard. As you know, February is called Heart Health Month. And so we decided to make our monthly fourth Thursday of the month wellness series event that we do together with our friends at Care Plus Health Plans and Omni Healthcare. We decided we were going to call it none other than Heart Smart. And so this program, which is absolutely free, has a lot of good things in store if you are there with us at Joe's Senior Resource Center. We're in the second floor of that beautiful Omni Healthcare Professional Tower right there at 1344 South Apollo Drive. And actually what's going to happen, Dr. Sheldon, there's actually three parts to this that happen every month. The first, there's a great presentation put together by our friends at Care Plus Health Plans. And this may tie into our conversation that we're going to get into today, but it's called Battling Stubborn and Dangerous Belly Fat. And somehow I think where we're going to go on this topic of diabetes, we're probably going to touch on some of this as well. Nevertheless, it's one of the parts of what's going to be talked about next Thursday, the 22nd, 11 a.m. to 12:30 at Joe's Senior Resource Center, Brevard. But then it gets better because Tammy Lieberg, who is the president of Practitioners in Motion, she's an autonomous registered nurse who actually serves as a primary care physician, primary care provider is probably the correct way to say it, for folks all throughout the county. And she's going to be there to give us a heart health talk. There's a great article she put together, by the way, in the February edition of Senior Scene magazine. If you go to that center section where Helping Seniors publishes our newsletter, you'll see that. But then she's also invited some of her staff members to help us do blood pressure screenings so that we can, make sure that if we're doing this at home, maybe on our own, that we're doing this correctly. And then actually, as we go along, then she's going to also be able to do blood pressure screenings for you each time, if you'd like, on that same day. So again, we're talking 11 to 12:30. This is Thursday, the 22nd. We're going to come back later in the show. I'm going to give you another date you want to keep in mind, which is going to be Saturday, the 24th, but we'll come back to that. And Dr. Sheldon, I was thinking about when they were talking about doing this free blood pressure screening there at Joe's Senior Resource Center on the 22nd. That's something you do as your patients come into the office. You're always checking blood pressure. Does that have to do with the diabetes, or is that for like different reasonings?
Well, I think when we're looking at any of these diseases, Kerry, we're looking at the tail end of a lifestyle problem. And so whether it's diabetes or high blood pressure or arthritis or cancer or heart disease or any of these things, you know, if we catch them at the tail end, then we're saying, all right, how do I treat it? Yet if we treat the body correctly, the incidence of all of these diseases will go down. And so we can approach it from a number of different standpoints. We'll check blood pressure for a number of reasons. Number one, because we're using drugs, local anesthetic in the office, which will raise the blood pressure for some people if we use the local anesthetic. So the patient already starts off with a blood pressure that's too high. Well, we've got to get the blood pressure down so that we can safely treat the patient. But that, as I said, that becomes the tail end of the tail end of the problem. Problems that we've been done or things that we've induced that we've done to ourselves chronically over the years, which has everything to do with poor diet. We'll go into that a little bit later on. Creates the end result of disease, and so the question is, where do we hit the disease? At the beginning, when we're doing things to our body that creates the disease, or the end where we have to take drugs in order to be able to control things, and frankly, we don't control them very well, even with medication. So, where do you hit it? So for us, we want to make sure the patient is healthy enough to undergo treatment, but at the same time, maybe it's a good idea if we take care of things so we don't need treatment at all. So that's kind of an introduction to how we're going to approach this today.
I was reading some statistics that you were kind enough to share as we were getting ready for the show. And it was talking about in the U.S., at least some figures that you had found from a year or so back, was talking about that literally almost 9%. I think the number that was quoted was 8.9%. That's almost 1 in 10 of the U.S. population has diagnosed diabetes. But this number was the one that really stood out for me. I mean, first of all, 1 in 10 is a very significant number by itself. But then when you talked about this area of prediabetes, which I'm going to ask you to explain a little bit more about, it said 97, almost 100 million people aged 18 or older, which is 38%. That's almost 4 out of 10 of us would be considered prediabetes. And there was actually some pretty shocking statistics that you also put in there about kids who themselves. You said 352,000 kids who are younger than 20 years old actually have diabetes. And then literally, when you got into the senior population, almost half. You said it was 48.8% at pre-diabetes. So I guess this is really almost an epidemic. So I'm glad we're having an opportunity to talk about it. But boy, there's a lot of this out there.
It is, and the stats are going up. They continue to go up every year. So, we get in the habit in this country of saying, well, I've got a disease. It's like, all right, I've got this, and so I have to see this specialist and I have to take this drug. When we're reaching epidemic proportions, as you said, then it's, wait a minute, don't we have to take a deep breath and find out where this is coming from and what the root cause is so that we can take care of this problem? And this is a problem in the United States. It's a problem in other countries as well, but it's particularly a problem in the United States. And it's a problem in the United States because of the way we treat ourselves, because of the poor food supply that we have in the United States, the poor food and how we buy it and how we are buying processed foods, and what we think is okay is not okay and wasn't even okay a generation ago. But now, because of commercialization of food products, everything is okay. So, you and I have talked about this. Well, moderation is the key. No, it isn't, because we have no idea what we're moderating from. The definition of moderation 50 years ago and the definition of moderation now are two different definitions. And frankly, we were out healthier 50 years ago than we are right now.
I want to get into this topic, and I want to ask you a basic question, which is, what is diabetes? I mean, we throw this term around like we actually understand what it is, but I want to get you to talk a little bit about that. But I just wanted to make a comment on the last thing that you said first, which is I think you're right, because I remember being a child and growing up, and there was two sizes of soft drinks. You either got the 6.5 fluid ounce cola in the little bottle, or then you could king size and get a 16 ounce. But today, everybody's getting like liters or I mean, it just seems like, when you walk into a fast food restaurant, they ask you if you want to supersize it. And I was thinking about that. It does seem like portions of everything are just getting bigger and bigger. And I guess that may be part of it. But maybe we start back at the root and say, what is diabetes and why are we trying to be so concerned about it?
Well, diabetes essentially is an insult to the pancreas. And the pancreas is the organ which is responsible for neutralizing sugar that goes into the body. And so if we overload the pancreas by having too much sugar or too much processed food, which also has sugar in it, then essentially we're damaging the pancreas. The pancreas can no longer neutralize the sugar in the bloodstream. When that occurs and we have then a high sugar containing blood, if you will, then our ability to fight infections goes way down. Our circulation is altered and altered for the worst. The capillaries, which are the small blood vessels, start to burst, and therefore we don't get a good blood supply to the organ systems that we need to be able to help function every day, and the body just deteriorates. It's interesting to note that even those people who have periodontal disease and have diabetes have worse periodontal disease. And the reason for that is that the immune system is actually stymied. It's stopped from working when the blood sugar is too high. And so the cells that we need in order to be able to fight disease in the mouth, and if it's happening in the mouth, it's happening in the rest of the body, those cells, the immune system cannot find the bacteria. Essentially, the sugar stops these cells from working, and therefore infection is much more prevalent in a diabetic than in the normal functioning population.
So when you talk about this, and then it's clear that that's what that is. But then when people bandy about this term pre-diabetic, I guess it means, I would just assume it means that if things don't change, you're headed down that road. And so hopefully you're heeding warnings or something, right?
It is. And the biggest warning that we have is something called the hemoglobin A1C, which is a very standard blood test, which is very inexpensive. Even if you don't have insurance, you can get a hemoglobin A1C done for $25. You can just go to a lab and get that done, or somebody can write an order for it and you can get it done. But the hemoglobin A1C, which most everybody who's listening here has had taken, is an indicator of what has occurred over the past 90 days and what your blood sugar level has been on average over the past 90 days. So it's a real good indicator as to where somebody is. If you have a hemoglobin A1C of over 5.7, then you're in the pre-diabetic stage. So that's warning. Warning. Something is happening that's not correct. You should have a hemoglobin A1C of about 5.4, 5.3, or even lower. If it's going 5.7 to 6.1, something along that line, then we have too much sugar in your system. But the nice thing is, in prediabetes, you're capable of healing if you reverse your ways now. So that if you've got too much sugar, too much processed food in your system, if you get back to basics and get back to fresh food, or even frozen food, but I'm talking about frozen vegetables, not frozen vegetables and butter sauce or frozen processed vegetables. If you get back to that, then your body has the opportunity to heal. Your blood sugar can go down right away. How do I know? Because I've seen it happen. And it's not that difficult to do, and the body can heal and you can function normally. Once you get to the point of diabetes, then essentially you've damaged organ systems through too much exposure, and then you can still heal. You can still do better, but you can't do as well as you could have if you had caught it earlier.
I think, and correct me if I'm wrong, because we see a lot of commercials that are talking about, now you can just avoid the stick and put, have these monitoring systems and all this. And I do remember people, who are required to take insulin, the blood sugars dropping and all these kind of things. It seems pretty complicated to regulate once you get into that kind of full blown diagnosis. And it really seems like if we have an alternative or an opportunity to be smart, we would start tackling this stuff early. And I guess that's part of the thing that we want to talk about on today's show.
I think that's part of it. And it may be for the group of people who are listening to this. It may be if you have diabetes, it doesn't mean that you're not capable of healing. But rather than treat it with medications, I'm not saying don't treat it with medications. You have to treat it with medications. But if you're relying on medications totally and you're not cleaning up the source, then you're too reliant on medications, and still your opportunity for severe disease or death is still significant. But if you clean up your act, then the opportunity for needing medications will be reduced. And of course, you do this with your doctor. And your opportunity for healing is still better than it would be if you retain the same crummy diet. And all right, so I'm using the word crummy, and I've been insulting people, and I've been known to do that from time to time, I guess. What's crummy diet? If you're getting frozen food that's processed and all you're doing is warming it up, you're getting an inflammatory diet, which makes you prone to diabetes. If you're getting canned foods, then you're likely to be able to create an environment where you're prone to diabetes. If you're getting anything in the middle of the store rather than the outside of the store, then you're prone to get diabetes. What I mean by the outside of the store, the outside of the store is where the fresh fruits and fresh vegetables are, where the meats are, and that type of thing. Although, I'm not necessarily a big proponent for eating meat on a frequent basis. Fine, it's good for flavoring, and you want to give yourself a treat once in a while. That's fine, but that's my bent. And a lot of people argue against me. That's fine, but certainly better than taking the processed foods which are already cooked by somebody else, or taking something that's in a can or in a box that's been processed by a machine and you're getting what's left. That's what's going to make you prone to diabetes, and also a lot of other inflammatory diseases such as heart disease and cancer, and some forms of cancer, and high blood pressure, and all the other things that we talked about at the beginning of the show.
As we're having this conversation, and again, I want to remind you, if you're just tuning in, that we're speaking with Dr. Lee Sheldon, noted area periodontist, and our topic on today is how you can help your diabetes. And that's not a presumptive statement because when we say, how can we help? Because when we read these statistics, 48.8% of persons aged 65 plus and over are pre-diabetic, and then the numbers, actually 8.9% of the U.S. population is actually diagnosed with diabetes. And I would assume probably a great number of those really are seniors in that. But we're talking, 4 out of 10 seniors are pre-diabetic, and 1 in 10 folks in the general population are diabetic. And so this conversation that we're having here on Valentine's Day, the day for sweet treats, is really interesting, that we're focused in on the things that would really help make you healthier. And Dr. Sheldon, one of the things I wanted to kind of have us explore for a moment is the fact that so many of these things, February is also Heart Health Month. And again, like we talked about at the start of the show, on Thursday the 22nd, we're doing a whole thing at the Senior Resource Center, Joe's Senior Resource Center, to kind of make sure that we're educating folks about this important topic. But when you start talking about diet, Dr. Sheldon, it has benefits, whether we're talking heart health, it has benefits, whether we're talking about diabetes, and it probably has a lot of benefit to just how we feel overall.
Oh, there's no question about it, Kerry. When we're looking at the tail end of of the problem. All we're looking at is seeing all of the things that we've done to ourselves, and what shows up first. What is it? Is it heart disease? Is it diabetes? Is it both? Is it arthritis? Is it periodontal disease? What is it? Everybody has a weakness, and the weakness is what's going to show up first. It doesn't mean you don't floss your teeth; you should. But we're making ourselves so much more prone. And if we look at that, and everybody's heard this, obesity is a tremendous problem in the United States. And if we just look back 3 years, we look at COVID and those people who died from COVID and had severe problems from COVID, it was the obese population who did. But it wasn't politically correct to talk about fat people. You can't do it for whatever reason. We've got our political correctness, which may have everything to do with pharmaceutical companies making money as a result of people who are diabetic. I understand this isn't just accidental. And so you have you have this whole predisposition to a disease which is going to kill people, meaning COVID, but it's not everybody. It was the obese. And so, but, are we going to interfere with our food supply? Are we interfere with the millions and billions of dollars that pharmaceutical companies make? No, we're going to do a drug instead. Well, let's go much earlier and take care of ourselves and not need the drug. We're going to do a lot better that way. So I'm presuming, and I don't have anything to do with the program that's going to be done at Helping Seniors of Brevard in Joe's Resource Center. But my guess is that they're not going to talk about drugs as the first part of this. It's the last part of this. The drug is an emergency thing that we use in order to be able to get things under control. And then you go back and you find out, what did I do to cause this? And you work with your doctor, and hopefully you work with a doctor who knows what to do, or you work with a nutritionist, preferably, because doctors aren't trained in nutrition. I was barely trained in nutrition, and physicians are trained even less than I was. So you go to somebody who specializes in nutrition, who can give you some guidance, who can get you on the right track, and hopefully remove the need for those drugs. And of course, you don't do that unless you do that with the doctor's supervision.
As you're talking about this, a lot of this conversation actually feels, if we're talking pre-diabetic, it actually talks more, less actually medical and more maybe common sense that we don't pay enough attention to. I guess it's so easy in our busy world to, run through a drive-through, or those donuts are calling our name from the grocery store shelf and things like that. And it just seems easy and convenient to do that. But it does seem like if we would stretch a little farther, we really could be doing ourselves a big favor in the long run.
I think so. I'm the one who cooks in our family, and the online resources that we have now versus the way it was 20 years ago is so much better that those people say, well, I don't know how to cook. Oh, for Pete's sake, you can follow a recipe, you can follow instructions, and you come up with something that tastes really good, and it's going to be fresh, and it's going to be non-processed, and it's going to be much healthier for you. People who revert to a normal diet, or what was considered a normal diet 50 years ago or 100 years ago, the weight will just melt off. It just melts off because the body is now utilizing those things that it needs. And when you're eating good things, the body says, all right, I don't need any more. And the hunger goes away. But if you eat the processed foods, you're not getting the nutrients, and you're hungry, you keep on eating and eating and eating and eating and eating. And what happens when you keep on eating and eating and eating and eating and eating? Yeah. That's what happens. The body will shut off as soon as it gets, and the hunger pangs will shut off as soon as the body gets the nutrients it needs.
This conversation here, Dr. Lee Sheldon, is really pretty important because as I keep thinking about, we have a number of folks connected with Helping Seniors who spend a lot of time in this area of nutrition. A gentleman comes to mind is Dr. Kevin Kilday for years, who's kind of been into holistic health, and he's actually a doctor of holistic health. And he always talks about the importance of nutrition. And you're 100% right, too, when we talk about Tammy Lieberg, who's the nurse practitioner who's going to be leading our talk on the 22nd there at Joe's Senior Resource Center, and she says the same thing. So we're going to continue this conversation on the second half of Helping Seniors. We'll see you back in just a moment.
Good to hear that music as we get back into the second part of our Wednesday show of Helping Seniors of Brevard. I'm John Harper. Let's get the second half going. Here's the host of Helping Seniors of Brevard, and as I always like to say, a daily double because he's also the executive director of Helping Seniors of Brevard. Here's Kerry Fink. Kerry?
Thank you, John Harper. It's good to be back right here, Valentine's Day 2024. It seems like we just hit the new year just a moment ago, and here we are already. It's chocolate day, it's roses day, it's sweets day, and we're talking diabetes. But I guess that's an appropriate topic with none other than one of our favorite guests of all time, Dr. Lee Sheldon, who's noted area periodontist with the practice of Dr. Sheldon and Furtado Solid Bite. But Dr. Sheldon, along the way, we have talked so much, many times, about how what you do in helping us with our mouth health really has to do so much with our overall health. And again, that's the conversation we're going to be continuing as we go along on today's edition of Helping Seniors Radio. So welcome back. If you're listening online at WEJF.net, or if you're listening to us over the air at 90.3 WEJF FM, or if you're continuing on in the podcast, we're glad you're here, and we are believing you're going to get something really good out of this broadcast. So, Dr. Sheldon, here we are on Valentine's Day talking about eating healthy.
Sugar. We're talking about sugar, and we're talking about eating healthy. You mentioned the fact that, we see a lot of patients, and of course, I've been doing this for a few years. I review medical history before I ever go into dental history. I go into what a patient is going through. And I say, people say, well, you're only a dentist. Well, yeah, maybe I am only a dentist, but everything that we're doing in the mouth, or everything that we're treating in the mouth, whether it's caries which is tooth decay, or periodontal disease, has to do with your overall health. If I'm seeing something under the gums, then it's obvious to me because it's right there, and I can easily reach that a lot easier than your doctor can reach a kidney or a liver. So what I'm seeing in the mouth is an indicator of what's going on in the entire body. One of the problems that we have in this country, and it may be other countries as well, I only live in this country, so I don't know. But one of the problems we have in this country is that we are reliant on people treating us. In other words, we take the victim mentality, and I know I'm insulting a bunch of people. I'm a victim. I have this, and therefore I'm seeing my doctor for this, and my doctor is prescribing that. That is the typical conversation that I overhear no matter where I am.
Wow.
The moment you say to yourself, I've got this, and I caused it, and therefore I have to treat it, is not only going to make you better, your doctor is going to be amazed. Your doctor is going to say, what did you do? That's fantastic. Keep it up. How do I know that? Because I've seen that happen. Doctors are paid only a certain small amount to do an examination. And we rely on doctors, on MDs and DOs for our medical care. They don't have the time to give you all of the guidance that you need. They don't. Now, they may be able to refer you to somebody for guidance, and if so, take that referral. You refer to somebody who's going to help you with nutrition, take that referral. Just don't ask for the drug. The doctors only have the time to diagnose, to come up with a treatment plan, but then it's up to you to follow the treatment plan. The beginning of the treatment plan may be the drug, it may be the surgery, it may be something else, but that's only the beginning of the treatment plan. The rest of it is up to you, and the treatment plan that you need has everything to do with your lifestyle, with your habits, exercise. Okay, I don't want to go to the gym. Well, you take a walk. Is certainly exercise. Well, I don't know how to eat right. Well, if you eliminate the center of the store, if you go to Publix like I do, and you go to the outside, you're much more likely, and even get fresh frozen fruits and vegetables, that's fine. You're much more likely to have that kind of diet that's going to help you heal. And let your doctor then become amazed when you've lost 15 or 20 pounds just by eating right. You're never hungry. You just eat right. And the doctor says, what did you do? Boy, your markers are a lot better. Your blood test is a lot better. Fantastic. I think we can reduce the amount of medication that you're taking. Keep it up, and I'll see you again in 3 months. We'll do blood tests again. If you keep on going like this, we may be able to take you off some of the medications entirely. Boy, that would be great. It would be great for your health. It'll be great for you. Your doctor will be proud of you, and you'll be proud of yourself. You'll have less pain. You'll have less disability, and your opportunity of living a longer life goes up tremendously.
You know, Dr. Sheldon, at Helping Seniors, Joe has always talked about making an aging plan, talking about Joe Steckler, our president and founder. And we euphemistically call that getting your ducks in a row. We're just trying to help you get organized in your aging plan so that you have good plans and you can live the best life that's possible. And one of the tenets that we've come up with along the way, corollary, whatever you want to call it, is we say, one of the things we say is don't try this on your own, because there is a lot of good help out there. But the other thing that we often say, and we've added that as kind of a sub-theme this year, is don't be an ostrich. Don't stick your head in the sand and assume this stuff just goes away. And I kind of wanted to jump back in kind of where we started a little bit and just share this statistic again, because Dr. Sheldon, these were some statistics that you shared before the program began. And I thought this was so interesting. You're talking about the prevalence of pre-diabetes in America. And overall, I think the statistic you quoted was 48.8%, or 27.2 million people age 65 and older are pre-diabetic. But this was the number that I really wanted to get at, because I was thinking, as you're talking about that we need to eat healthy, I know a lot of times that probably sounds like the teacher talking to us on a Charlie Brown cartoon, you know, where you just hear womp, 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 and you're going to go off and do the thing that you normally would do anyway. And it's kind of in one ear and out the other ear. But I wanted to share this statistic in the hope that it might get you to say, hey, wait a minute, I really need to pay attention to this. And here's what this point is, Dr. Sheldon. In a little chart that was part of the notes that you sent along, it said that folks 65 plus are 48.8% pre-diabetic. But I thought this was an interesting number. If I'm reading this correctly, it says pre-diabetes awareness. And that number was 23%, which means that only about less than half of the people who are pre-diabetic are even aware of this. And this was the other number that I thought was even more, maybe more shocking, is that amongst adults 45 to 64, again, if I'm reading this correctly, it says 44.8% are actually estimated to be pre-diabetic, but only 20% of those, 20.6 exactly, are aware that this is out there. So I think a great number of us are ostriches with our heads in the sand, and we're not paying the attention to this that we ought to, Dr. Sheldon.
It's true. And we're seeing it also in kids. You know, we're seeing it in kids who are eating processed foods, and that's where the obesity is going up. And kids is so reliant on processed foods that, in fact, that's not covered in the statistics that we have here. But you're right. And so let's talk about, how do you know you're pre-diabetic? And we talked about this earlier, but for those who are just getting onto the show, ask your doctor to run a hemoglobin A1C. The letter A, the number 1, the letter C. That's all you have to do is say to your doctor, can you run an A1C as part of my blood test? So when the doctor runs the A1C, it'll be one of the blood tests that you'll get done. It's very simple to do, and it's very inexpensive if you have to pay cash for it. If you have an A1C that's 5.7 or above, then you're at least a pre-diabetic. Now, so that allows you to know where you are. You should be at the 5.4, 5.3 level. If you're 5.7 or above, then you've got a problem, pre-diabetes problem. it's at that point where you can say to yourself, or you can find out, what do I do about this? And the answer in that case is not a drug. That isn't the first thing you do. The first thing you do is find out what you're doing dietarily, get some advice from a nutritionist. And by the way, you can go online and get a lot of good advice. The book that I love is a book called The End of Diabetes by Dr. Joel Fuhrman. The End of Diabetes by Dr. Joel Fuhrman, Fuhrman. I've read this book, and it essentially takes those numbers that you're being given by your doctor, and it takes a nutritional approach to those numbers. Some of the nutritional approaches for you may be a little bit different, and you might find them very, very satisfying, but it gives you some ammunition because your doctor doesn't have the time to give you all of the ammunition. That's just not the way our system is built. Our system is built based on disease, not based on health. So you read this book. It's a good book to read. It's easy to read. It's not written for doctors. It's written for lay public. And you can start to get more information about your problem. And so when you're talking about, Joe, getting your ducks in a row or coming up with an aging plan, once you read this book, you can come up with your own plan. By all means, get assistance from your doctor and from allied personnel, but you can come up with your own plan. You can be knowledgeable about your problem. You can reverse your prediabetes and have years and years of health.
You know, what I love about what we're talking today is that so often it feels like we're surrendering our medical treatment in a medical office to a doctor who is probably extremely knowledgeable. They're very educated. They know a lot, but they probably only have 5 or 10 minutes to actually visit with us. And so we're abdicating really the most important. In fact, we started this year, Dr. Sheldon, off with point number 1 on your aging plan is wellness, because, you know, as your health goes, so does everything else. You could have all the money in the world, but no health, and you got a real problem. So we really want to begin thinking about our aging plan from this viewpoint of, let's think about the building blocks. The better we feel, the more we're able to do. And I think that's what you're really talking about here, is that so much of tackling the prediabetes, or maybe even if somebody has been diagnosed with diabetes and is having to have treatment for it, it still seems like some of these healthy thoughts that we've been talking about are still going to make a difference. The right diet, and then you mentioned a lot about exercise too.
I do. And there is that capability of the body to heal, but we've got to give the patient, the person, him or herself, has to give the body an opportunity to heal. We don't know how good the body can do. And in the article I mentioned somebody who I'm very close to, who essentially gave up because she was given the wrong information by her doctor. She was told she was going to die in 3 months. It's now 5 months later, and she's doing pretty darn well.
Wow.
And what she did was to let herself go. And once she found out that she was still living and didn't let herself go again, she's feeling much, much better. We never know what the body is capable of doing until we give the body a chance to function as well as it possibly can. And so the person I'm talking to is probably going to live years and years and years, and she'll be able to stick out her tongue at her doctor, say, "Na, na, 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 you see, that wasn't correct." But it is a matter. So I'm taking the worst of the situations where somebody is told she's going to die, and she's living. So if we're just talking about somebody at the worst stage, imagine what we can do when we're in the stage where we've got chronic aches and pains and we're taking too many medications and all of those types of things. Look at what the body is capable of doing if we give the body a chance. And that means eating right. And eating right means that we're using fresh food, not packaged food, not food that's been processed, not food that we're warming up, but fresh food. You know, use the stove a little bit, and it can be a lot of fun, and you can get it all done in a half an hour, and you can have something that's good to eat. You can feel good. You won't be hungry anymore because you're eating good things. And your body is going to heal, and it's not going to take very long. A matter of weeks, you'll feel better. Not it's not going to take years, a matter of weeks. You'll feel better, and boy, take fewer medications, take less medication as a result, under doctor supervision, of course. You're going to do yourself a big, big favor and enjoy life. Imagine the amount of depression that we have right now, and the amount of depression that we have has everything to do with the fact that we're eating wrong. As soon as we start to eat right, you don't need antidepressants. Just give yourself some good food. And a number of people who are taking antidepressants right now won't need them anymore.
Yeah, it's pretty incredible when you think about it, because I've definitely, there's a retired pharmacist who is volunteering her time now with the Helping Seniors organization. And her big thing in her retirement years, and she wants to do this really as kind of public service, is wants to help seniors with this concept of polypharmacy, which is the term, and I may get the technical definition a little bit skewed, but basically, as I understand it as a layperson, it means you got medicines that you're taking that are actually potentially fighting with each other because they're each trying to do a job, but they each have a side effect, and somehow when you put it all together, it doesn't work. And her point is that so many seniors take medicines because you go to the doctor, you say, well, here's my complaint today, and you expect to walk out with yet another prescription. And she's very much in that same mindset, Dr. Sheldon, that we probably really need to sit down and take a holistic approach and figure out, what is actually necessary and what can we do lifestyle-wise that might make that difference.
She's absolutely right. And of course, the drug company is there to sell drugs. And so if you take a drug and you get a side effect, guess what? They're coming up with another drug to take care of that side effect. But of course, that drug will cause other side effects. And so you need more medication in order to be able to take care of those side effects. You end up being a very unhealthy person. A lot of people are taking digestive medications, and they're taking digestive medications as a result of the drugs that they're taking in order to be able to control a chronic disease. And if you were just able to get back to a basic lifestyle, you wouldn't need either, or you certainly have reduced reliance on either. And it's just what can we do, and what can we do for ourselves to make ourselves better? And by the way, it's pretty cheap to eat that way too.
Yeah. We're talking with Dr. Lee Sheldon, noted area periodontist with Dr. Sheldon and Furtado, Solid Bite Dental. So it's kind of always intriguing, Dr. Sheldon, that as an expert in our mouth health, you really invest yourself so much in knowing everything that you can about nutrition and how it impacts. And that's why we're talking here on Valentine's Day, the day that normally you might give someone a box of chocolates. Maybe there's a better Valentine's Day gift. What do you say, Dr. Sheldon?
I'm debating with my wife right now whether I should give her chocolates or not. Here I am doing this radio show. She likes the chocolates. She and I have done a lot of work on our diet over the past year. But do I do it? Eleanor is very good at limiting herself to one a day. So I'm probably going to do it anyway. But yesterday she said, you know what? I like what I buy better than what you buy for me. So let me buy it myself.
Well, I think the real point in all of this is, and we that's what I was trying to make the point earlier. I don't know if it's right or not, but we often abdicate our common sense. We walk into the doctor's office and say, give me a pill for this. When what we probably ought to do is, like you were mentioning, maybe grab a copy of that book, The End of Diabetes by Dr. Joel Fuhrman, and invest in ourselves. It's like so inexpensive to figure this out if we would just apply ourselves, and we might really surprise ourselves at how much better we feel.
I think so. We get the idea that, medicine is so complicated and, I need my doctor to figure this out. If in fact medicine is that complicated, then look at non-medical approaches, which aren't very complicated at all, and see how well you can do all by yourself. And your doctor will give you a standing ovation. I do. I've done that. I've had patients who've gotten themselves healthy, maybe as a result of some suggestions I made, or maybe they did it on their own. The first thing I do, the heck with your dental care. get some acknowledgement for what you've done for yourself to make yourself better. Because what you do to make yourself better is going to mean less treatment, less expense, more comfort, and, ability to do a lot of the things that you've wanted to do, but you said, "Oh, I can't do it anymore." Well, yes, you can. If you treat yourself right, you may have you may be able to find yourself doing things that you didn't think you could do 20 years ago. That's how important a good diet and a little bit of exercise is for you.
Yeah. Well, I want to reserve a moment or two to share a couple of dates and things that are important, hopefully, that will be fun and good for us to all kick into here. But before we do that, Dr. Sheldon, I wanted to make sure people know how to get in touch with your office, because for two reasons. There may be a question that came up and they want to learn more or get some information. But also, you have a great thing that helps us as a fundraiser in the Helping Seniors world, which really can get you on the right track dentally as well. I think you call it Solid Bite Gives Back, but give a number and how people would follow up from here.
Yeah, we love that program because we've collected well over $200,000. I think it's closer to $300,000 now through our Solid Bite Gives Back program. That essentially means donate $50 or more to Helping Seniors of Brevard. Just write a check, bring your check into the office, and you will get the entire examination, which if you take a look at our Google reviews, you'll see how extensive the examination is that we do. And you'll get that all for no cost as long as you give $50 to Helping Seniors of Brevard. Just call our office, 321-259-8000, and anyone who answers the phone will be able to give you the details on that program.
Yeah, well, thanks, Dr. Sheldon. So again, I want to hit a couple of dates we already talked about at the beginning of the show. The 22nd, that's a week from tomorrow. That would be our Heart Smart Wellness Series event. It happens at 11 a.m. at Joe's Senior Resource Center, right there, 1344 South Apollo Boulevard. It's the beautiful Omni Healthcare building. They've given us a great space up there on the second floor, and we're taking it over and doing everything we can to have a positive impact for seniors there. So that is a great seminar with our friends from Care Plus Health Plans and also Omni Healthcare. So some really good information about Heart Health Month. And then the other date that I want to make sure that I get in here on today's program is actually that following Saturday. So 1 week from Saturday, it's Saturday the 24th. And this is a big day for us, Dr. Sheldon, because we're going to have an open house there at the center. And since it's a Saturday and there's no doctors and patients happening there on Saturday, we're going to take over the parking lot. And we're going to have another big car show. Our friend Bill Antonetz is bringing out 150 classic cars out there, and we are going to have all 6 cars. We haven't even announced all the models yet, but they're all going to be out there with us on Saturday the 24th. This is 8 a.m. to 11 a.m. Saturday morning, right there, 1344 South Apollo. Our great friend Bill Antonetz, who does so many of the great car shows in the area, everything from the Duncan show to the Panera show. He's behind the Friendly's car show, just popular monthly events. And he's kindly coming back to help us put this show together. So there'll be food trucks out there, lots of great stuff. You can check out the 8th annual Choose Your Adventure Helping Seniors car raffle, because you choose the brand new winning car when we pull your winning ticket in October when we get back to the American Muscle Car Museum. So it's a great chance to come out, preview the cars, be first to get your tickets. Maybe a low number is lucky for you because all the tickets are numbered. So maybe you can get the lucky number when you come out on Saturday. But in all cases, a fundraiser for Helping Seniors, and upstairs on the second floor, all at the same time, we will, in fact, be there with an open house. So that means lots of good, hopefully healthy snacks. And we have some entertainment upstairs. You'll be able to meet all the center partners, and a lot of the Helping Seniors friends and family are going to be out there. So it's almost like a mini senior expo that's going on kind of the same time. So it's all happening Saturday morning, the 24th, 8 a.m. to 11 a.m. right there at Joe's Senior Resource Center, 1344 South Apollo Drive. So we're so excited for all the great things that are coming up. You can always find information about Helping seniors and things that are going on. There's a good calendar on the webpage at helpingseniorsofbrevard.org. If you like Facebook, you can always keep up with events going on the Helping Seniors of Brevard page there. And another great place to always find out things that are happening is in your Senior Scene magazine, free copy. They distribute it at 500 plus locations around the county. And I think he prints like 14,000 copies a month. And so every month when you get your copy, you look inside. Right there in the center is the Helping Seniors of Brevard newsletter. So it's 12 pages, chock full of information. We try to really help you along on your aging plan there. It's absolutely free of charge. Get your copy. You can also read it online at helpingseniorsofbrevard.org. And one last thing, Chris Morse with the Helping Seniors Travel Club says there is space available on June 9th. What is that? That's the 4th annual Helping Seniors Foundation Cruise. It raises money for the organization, and it's a fantastic travel deal for you because the way Chris puts it all together includes everything. Once you've paid for your cruise, you don't spend any money on board unless you want to, because he's included drink package, internet package, prepaid gratuities, the whole thing. And he got some incredible pricing considering that this is a June 9th sailing right from the Port of Canaveral. Great opportunity. Kids are out of school. Invite the kids, invite the grandkids, have a big family reunion on board. It's affordable. It's fun. We're going to sail right here out of Port Canaveral. Come find out what the excitement is. We've had hundreds of people sail with us in the prior cruises, and we hope you and your family will be one of the ones that join us when we get together on June 9th. So call us, 321-473-7770, and we'll help connect you to that information. See you next week on Helping Seniors Radio.